My name is Dr. Joseph Tansey. I'm an orthopedic surgeon and I work at the Henry County Health Center in Mount Pleasant, Iowa. I offer a wide variety of orthopedic surgeries. Starting at the top and working down, we're talking about shoulders, elbows, wrists, hands, and fingers. And then in the lower extremities, it's the hips, the knees, the ankle, the foot, and the toes. The majority of my surgeries that I perform are outpatient surgeries due to a variety of reasons, whether it's insurance reasons, whether it's care reasons, or whether it's medical reasons. And the push is for patients to go home. One, because patients feel more comfortable at home. Two, oftentimes you're much less likely to get a complication if you're not in the hospital, it seems like, because the hospital is full of people that have sickness. As I operate on many parts of the body, I do have a specialty in foot and ankle surgery that I completed a fellowship in foot and ankle after I finished my training. When I moved here from Chicago, my previous practice was primarily a foot and ankle practice. But when I moved to Mount Pleasant, I knew that I was going to be entering into a general practice. Despite the fact that I've entered into general practice for these past several years and done many knee and hip replacements and shoulders and things that aren't related necessarily to the foot and ankle, I've been able to maintain that foot and ankle training and still accept many patients with complicated foot and ankle issues that many orthopedic surgeons feel uncomfortable or don't desire to work on. I feel that I'm a good listener to my patients, that I don't just focus directly on saying, how can we operate on you today to make you better? I would say the majority of my patients actually get better without surgery. I see many patients in a day, and maybe only a few of them will actually require a surgical intervention. I strive to give patients the opportunity to say, we're going to have medications, bracing, therapy, injections, and surgery as our last option. And patients, I think, appreciate that idea that they're going to be able to not just come see an orthopedic surgeon automatically assuming that they must have surgery. So I think that's one benefit about seeing me as opposed to someone else or some places where they're just trying to say, how many cases can I do? I'm really trying to say, how many patients can I help? I think that my patients enjoy the fact that we're in a small community hospital and they're getting that small community personal hospital care, like someone's brother or sister or mother or father, that encourages you to come back and continue to work with us. And if it comes down to patients often ask me, well, what should I do, doctor? And my reply is, well, if you're my mom or my sister or my daughter, you shouldn't have surgery. Or you know what? You should have surgery, depending on the case as it needs to be happening.